Hello, my name is Mary Agnes Ostick. I'm a nurse practitioner at the Villanova Student Health Center. For those students traveling abroad for service trips, the Student Health Center offers a travel clinic. Typically, the dates of this clinic is 1 month prior to fall or spring break. Appointments are available so that you may receive immunizations and prescriptions necessary for the specific country to which you travel. This appointment enables you to build the immunities you will need prior to traveling into a country. Please make an appointment at your meeting, and please be sure to keep your appointment. Come to your travel clinic appointment with knowledge of any previous vaccines that you may have received since your admission here to Villanova, especially if you have traveled on a previous service trip or a trip that took you out of the country. Graduate students, please bring with you any copy of your immunization record. Did you receive 2 vaccines against hepatitis A? Have you ever received a typhoid vaccine? When? And when was your last tetanus vaccine? Do you know what type of tetanus vaccine you received at that time? Please check with your family health care provider at home before your visit to the Student Health Center. You should also be aware of any medications or allergies to medicines that you may have. Once you arrive for your travel clinic appointment, you will receive information about your travel destination, the necessary vaccines, and prescriptions to ready you for your trip. Typically, hepatitis A vaccines, typhoid vaccines, and possibly an update to your tetanus may be necessary. Note that the Student Health Center does not offer yellow fever vaccines, but we will refer you to an off-campus travel clinic if it is required. In addition, you may be given a prescription for an anti-malarial medication. Malaria is a serious disease that is acquired by an infected mosquito. There are specific medications to prevent malaria. It is critical that you take this medication as prescribed. You will begin the medication prior to your travel, and you will be required to continue it after you have returned home. You will also be given a prescription for traveler's diarrhea, which you should pack in your suitcase and take with you in the event that you may need it. After you receive your prescriptions, you will need to go to a pharmacy to obtain them. Be familiar with your healthcare insurance and prescription plan. Before you travel, refer to the CDC website for up-to-date information about your destination, www.cdc.gov/travel.org. It is important to practice healthy prevention strategies. The CDC recommends proper clothing and insect repellents to prevent any mosquito-bearing illnesses. Bottled water helps prevent gastrointestinal diseases, and sunblock is a must. Review with your group and team leader the CDC recommendations. After you return home, the most important thing to know is that if you become ill with fever, flu-like symptoms, abdominal pains, or any other symptoms, that you seek medical care and tell the healthcare provider that you recently traveled outside the country. Some parasitic disease symptoms occur well after return home. And if you travel to a country that has a high incidence of tuberculosis, please make sure to get a TB test done 8 weeks after you return home, either here at the Student Health Center or at your family healthcare provider at home. The Student Health Center is happy to answer any of your health travel needs, questions, and we hope you have a great trip.